Buncombe County, before I got on board, and I certainly won't take credit for this, but we have had a policy in Buncombe County for about 20 years where we will take care of everybody's, including adults, primary care. We will refer people to specialists. If you go to the health department now, the Western Carolina Minnie Jones Clinic, and you have a headache and you need a Goodies powder, we're going to give you a Goodies powder. If you have a headache and you have a brain tumor, Buncombe County will refer you to a neurosurgeon and get help. We do it all here. We've won awards from Harvard School of Government. I have personally entertained people from other countries in France and Spain that actually came to Buncombe County to see how we're doing this. Now, it was a great system. We had a great health department. We had some of the best workers in the country. They were cutting edge. But what happened was, back then, we were missing about 300 people a month that we couldn't serve, that wanted our service, that were Buncombe County residents and couldn't get in there. So, here are the numbers. In 2010, when we changed it, we served 9,145 patients. Of those, 6,500 were adults. That was the last year of the health department. That was phenomenal. That was a national model. I don't know if it was a record, because I'm sure bigger places had bigger numbers, but it was something we're very proud of. And we dismantled that, contracted with Minnie Jones Clinic, and we are now up to 13,561 people, almost 12,000 adults. Now, that's really important because 96% of them are below poverty. And so we're taking care of the people that we should take care of, folks that don't have any other way to see a doctor. But we've leveraged money. We have Western Carolina Community Health, Minnie Jones, has been a wonderful partner with us. We're going to keep ratcheting up the numbers, try to get more and more people in there. We had over 66,000 visits if you just look at contacts. That's a lot of health care for folks that need it. It's free. And it's the right thing to do. I hope one day our national government gets it together and has a good health care system, but we don't right now. It's very messed up. You know that, I know that. But we're doing a good job here. We want to keep doing that. We're also now, we're covering 1,100 more people with dental. Now you might say, well, dental's cosmetic. I don't have dental. Why should you do that? But folks, we're talking about diseased teeth. We're not talking about braces. We're talking about teeth that have problems that are sometimes, they can be life-threatening, but certainly health-threatening. And we're seeing 1,100 more people. Last year, Western Carolina Community Health and Minnie Jones saw over 3,000 people for their dental needs. 3,000 new patients. We're just proud of what's going on there. It's a good thing, and it needs to be done. Our budget, again, $337 million, 1% increase from last year. Some of the reasons that it's more is Linamar. And as I've said, we've got a new, Linamar's up to 650 jobs. We're having to pay the incentives it took to get them there. Good investment for the taxpayer. I'll tell you, the 655 people that get jobs, they're going to think it's a great investment, because then they're going to be self-sufficient. They're going to have money to buy houses. They're going to have money to put their kids through school. They're going to have money to do what you and I do every day, which was lead a good life. And that's what we need to do. Those are some of the issues we talked about at our June 19 meeting. Our next meeting won't be until August, so there'll be a long period of time. As always, if you have any questions or any issues you want to talk about, please call me, please email me. I'll get back to you as soon as I can, and I appreciate you for listening.